All right, good afternoon, everybody. We are here today because Republicans in Congress are pushing a budget plan that would be absolutely devastating for nursing homes here in Rhode Island and across the country. There are over 8,000 Rhode Islanders who rely on nursing homes for shelter, for food, for high-quality medical care, and for many of those residents, they would have no place else to go if it were not for nursing homes. For many of their families, it's the only way their family members can continue to go to work every day, knowing that their loved ones will be taken care of. But earlier this week, Republicans in Congress passed a budget plan that will literally put nursing homes in Rhode Island and all across the country out of business and put their residents out on the streets. 65% of nursing home residents are on Medicaid as their primary insurance. And nationally, I don't know about in Rhode Island, we'll hear from our leaders who are here, but nationally, more than half of nursing home revenue comes from Medicaid. But the budget that was just advanced in Congress would cut Medicaid by up to $880 billion, mostly to pay for tax cuts to benefit the very wealthy. I'll say that again. Nursing homes rely on Medicaid for most of their revenue. The budget plan that was advanced in Congress this week would cut hundreds of billions of dollars from Medicaid in order to pay for tax cuts for the wealthy, and would cause many nursing homes across this country to have to shut down. That would be absolutely devastating. Devastating for residents, devastating for staff and employees. And I should have opened by thanking all of the staff and the residents here at Bannister House for hosting us today on short notice. This is sort of an emergency gathering, and so I want to thank you all for having us. But we're in a very dangerous situation right now, and thousands of Rhode Islanders could be impacted. So here are the facts. The budget plan that was advanced directs the Department of Energy and Commerce to make $880 billion of cuts. And now they claim, well, we don't necessarily mean Medicaid, we don't want deep cuts to Medicaid, but here's the reality. They could cut everything under the Energy and Commerce Committee besides Medicare and Medicaid. They could cut everything down to zero. And all kinds of things fall under the committee. The National Weather Service, they could eliminate that. They could eliminate NOAA. They could eliminate all regulation of utilities. All of the other things that Energy and Commerce does. They could eliminate all of it, and that would only save them $200 billion. The other $680 would have to come from Medicaid or Medicare. That's it. That's the math. And so we know what that means. It means that nursing homes would have to shut down, residents would be put out on the street, would not have access to shelter, to care. We are standing here together today for residents who deserve quality care, for staff who provide essential life-saving services, and for our whole state. Because, again, it's not just the residents and the staff in the facilities who benefit from the work that is done in nursing homes. It's all the families of the residents and the staff. It's our whole economy. This is absolutely crucial to our ability to function as a state and as a country. And these cuts would put facilities at risk, would create closures, would create staffing layoffs, and leave people without care. The good news is this fight is not over. It's just beginning. Because what was passed through Congress last week was just the first step in the process. It was their plan. We will have another opportunity to vote on the final budget probably in May or April. And that will be our opportunity to kill these Medicaid cuts once and for all. All we need to do is find one or two Republican members of Congress who will flip their votes and come over and join us to prevent these cuts from happening. We already got one this week who flipped. We just need one or two more. That's it. And if we do that, we can preserve Medicaid funding for nursing homes, for community health centers, for hospitals, but especially for the residents, the patients, and the staff who make these facilities run. So I'm going to keep fighting on this with everything that I have, and I want to introduce the real experts here who can tell you how high the stakes are and what the impact would be for Rhode Islanders. We're going to hear from John Gage, the president and CEO of the Rhode Island Healthcare Association, which represents the management of most of the nursing homes in the state. And then we're going to hear from Jesse Martin from the Service Employees International Union, Local 99, who represent many of the staff at these facilities. And I just want to thank both of you for doing this on short notice. This is something where all of us need to come together and form a united front, and I think it's a real testament to both of your leadership that you're doing this today. So we'll start with John. Thank you.
Thank you, Congressman. As Congressman Magaziner said, my name is John Gage. I'm the president of Rhode Island Healthcare Association. We're a trade association, and we represent 62 of the nursing facilities in Rhode Island. As Congress embarks on the budget reconciliation process, the Rhode Island Healthcare Association, together with our national association, urge lawmakers to protect Medicaid from devastating cuts. The program is the primary source of coverage for residents of nursing homes. One of Medicaid's core functions is to protect our nation's most vulnerable. It is a critical safety net for America's seniors to make sure they can access the long-term care services they need. It's no secret that Medicaid is already underfunded, so any further cuts would be devastating. We will continue to urge lawmakers that there's a better way to create government efficiencies while upholding the promise made to our nation's seniors. Most nursing homes rely on Medicaid. Most nursing home residents rely on Medicaid to cover their daily care. Across the country, Medicaid is the primary payer for 2/3 of all residents in nursing facilities. In Rhode Island, it's 65%, nearly 5,000 Rhode Islanders on any given day. Medicaid covers long-term services and supports to help individuals with basic activities of daily living: bathing, dressing, walking. Many of these critical services are not covered by Medicare or private insurances. For nursing homes, Rhode Island Medicaid reimbursement rates have already failed to cover the actual cost of care, leaving providers with a significant financial shortfall. As a result, the average nursing home operates in the red. Without adequate Medicaid reimbursement, nursing homes and other long-term care facilities would struggle to compete for workers, enhance care services, and to keep their doors open. In Rhode Island, nursing homes still need more than 1,100 workers to return to their pre-pandemic workforce levels. Proper funding could assist with staff recruitment and retention. As access to nursing home care in Rhode Island has declined in recent years as 9 nursing facilities have closed. Nearly half have had to limit their admissions, and 20% have had to downsize. And the demand for Medicaid and long-term care services and supports is only going to continue to increase. Over the next 5 years, the number of individuals over age 80 is going to increase by 4 million to nearly 19 million. More than 17 million older adults aged 65 and older are economically insecure, with incomes below the 200% of the federal poverty level. Medicaid is largely viewed favorably by the American public, including 2/3 of Republicans. According to research, large majorities of the public view the Medicaid program favorably and think the program works well. This remains true across party lines and has remained consistent for years. Favorability of the program increases as individuals have personal experiences with Medicaid or through the experience of a loved one. The bottom line, for the sake of our seniors and states, Medicaid must be protected from major cuts. Thank you.
Thank you, Congressman. And my name is Jesse Martin, the Executive Vice President for 1199 New England. We represent Rhode Island over 5,000 healthcare workers in nursing homes, group homes, hospitals, federally qualified clinics, and many other social services. Here in Rhode Island, 300,000 Rhode Islanders are on Medicaid. And over 5,000 nursing home residents pay for their care with Medicaid dollars. I want to thank and highlight the employer here at Bannister House. We represent 90% of the frontline staff here. We reached a collective bargaining agreement just a few months ago that is going to put workers on a pathway to competitive wages, benefits, and staffing conditions. And the partnership with labor and business sometimes is uncomfortable. But when funding for these services are at risk, we look at the greater good. There are thousands of Rhode Islanders, nearly 9,000 Rhode Islanders work in nursing homes across the state. To imagine a world where they take a pay cut, they lose their jobs, the impact on our local economy is going to be devastating. The impact on the quality care of our most vulnerable Rhode Islanders is going to be devastating. The work that Congressman Magaziner and our federal delegation is doing to fight back against these cuts is vitally important. And in particular in this state, in this facility, that cares for many of our family members because of the needs that they have medically, they cannot risk going to another facility. They cannot risk not having enough staff to care for them. And these cuts at the federal level are going to undermine all of those issues. And in particular, I just, again, focus on nursing home workers in the last 5 years. And nursing homes have seen a lot of hardship. On March 11th is the 5th anniversary of COVID-19, which because of the historic underfunding of Medicaid, had a disproportionate impact in nursing homes. We can't go back to that time. We can't go back in time to a place where we're underfunding the health care of anyone. We need to continue to advance these needs at the federal level in significant ways. I'll mention that we have members here that have spent 30 years serving the residents of Bannister, which has been the backbone of the social safety net of the state of Rhode Island and Providence for a long time. The impact of these cuts at the federal level would have a massive impact on our local economy and healthcare. And not just in nursing homes as well. We rely on a throughput, a system of healthcare from hospitals to nursing homes to primary care. And these cuts could put in danger all of those elements of our healthcare institutions and undermine workers' wages, retirement, healthcare, and destabilize our economy. And so, again, we call on national Republicans to look at this budget in an honest way and be real with each other about the impacts on our society. And we call on Rhode Islanders. If you have a family member in a nursing home, you have a family member who works in a nursing home, let's pick up the phone and let's call our elected representatives and encourage them and continue to support them in this fight in Washington to ensure that this benefit stays and this benefit doesn't get any tax. Thank you very much.
Thank you, Jesse. We'll take questions, but I'll just close by saying, we're here today to sound the alarm, right? Because public opinion matters, and the public needs to be educated about what is going on and what the consequences would be. And so I want to thank everyone on short notice for coming together to help us sound the alarm. I am going to be fighting very hard, along with the rest of the Rhode Island delegation, Jack Reed, Sheldon Whitehouse, Gabe Amo, to make the case in Congress. Again, we just need one or two of our Republican colleagues to come over with us and commit to preserving Medicaid and not letting a single nursing home shut down in this country because of Medicaid cuts. We're going to be talking to them because many of our colleagues from both parties, Democrat and Republican, from all over the country, have a very high percentage of their constituents on Medicaid, including in facilities like this one. Many of them come from districts where an even higher percentage of their constituents are on Medicaid than we have here in Rhode Island. And so we need to make sure that we're sounding the alarm to let people know what is happening. As I said, what happened this week was unfortunate. It was outrageous. To put forward a plan for hundreds of billions of dollars of cuts to Medicaid that will impact nursing homes in order to pay for tax cuts that would mostly go to rich people is outrageous. But it was just the first step. This is not over yet. We've got a couple more months to fight this out, and I do believe that if we sound the alarm, we will be successful. So thank you again to John and to Jesse and to everyone from the Bannister House community for the work that you do to support Rhode Islanders and for having us here today. And we will be happy to take questions if there are any. Pat.
Congressman, the last vote, I believe, was 217 to 215.
Correct.
With one dissenting Republican. Other than that, it was by party lines. The political landscape obviously is evolving on a daily basis. Do you get the sense that there are additional Republicans who would be willing to work with the other side?
I'm hopeful. I mean, there are at least a dozen Republican members who have on the record said that they are worried about Medicaid cuts and that the only reason they voted yes this week was because this was the beginning of the process, not the end of the process. You've also had President Trump say that he doesn't want Medicaid, big Medicaid cuts. The thing is, though, the plan that they passed, like, the math doesn't math, right? Like, the only way that you find $880 billion of savings within the energy and commerce umbrella is by making huge cuts to Medicare or Medicaid. So I don't know if they just didn't realize that or if they voted to start the process, but they're not committed to voting to follow through on it. But whatever the case may be, the answer to your question is yes. I think that there are a number of Republicans in Congress who are movable on this, but they need to hear from their constituents.
And I guess my other question would be, independent nursing homes in particular in Rhode Island over the last decade have really been put on the endangered species list. Do you have any sense, and I'd address this maybe perhaps Mr. Martin, what these cuts would do to the number of independent nursing homes, and at the very likelihood, how many jobs you would lose as a result of that? Any sort of ballpark estimate?
Each of you.
Yeah, I think that, look, you're talking about, there's nearly 9,000 workers in Rhode Island nursing homes. You have cuts of these magnitude, you're talking about thousands of people lose their job. You take beds out of the system that need to be there. And when you destabilize a healthcare system, which these cuts would do, there's going to be a lot of shifting things. You know, shifting consolidation of who owns them, consolidation of who operates them, closures, sales, everything in between. And that creates instability in people's daily life. Creates instability in workers' lives, creates instability for the people who live in nursing homes and receive care in them, and no one deserves that level of instability. Medicaid is a commitment we make to the most vulnerable citizens and residents of our state and our country. And to do what the congressman said is the goal, which is to take money from a program for our most vulnerable and essentially give that money back to the rich, the very few who already have plenty of money, is wrong. It's just wrong. So the impact is there's going to be a lot of people that are not going to have a job, or if they do have a job, they're gonna have to get paid less money, less hours, less benefits, and that has an impact on their children, on their husbands, on their wives, and then less money in our communities to buy a car, buy a house, which is already hard enough in our current economy. It's gonna make all of those pieces much more difficult.
I agree with almost everything that Jesse said. I think the amount that I heard for the Rhode Island cuts would be $220 million. If they take $220 million out of Rhode Island Medicaid, nursing homes will close. There'll be wholesale closures. I mean, they're already losing money. It only covers about 82 cents on the dollar of our expense currently. So if you cut 220 million more, there's just no margin left. So it would be devastating.
We can come back if you have more, but anybody else?
Oh yeah, I do. Yesterday I was talking to the speaker and he said the budget is a very difficult budget this year, in part because he doesn't know what these cuts are going to be.
Correct. And I think, I think everyone knows this already, but Medicaid is funded part by the federal government and part by the state. It flows through the state. And so, as I understand it, the state is already facing about a $300 million deficit.
Right.
If Medicaid reimbursements from the federal government are cut by an additional $200 million, now the state is facing a $500 million budget deficit, and the state's going to have a decision to make. They're either going to have to cut other services in order to plug the budget gap, raise taxes significantly, or disenroll people from Medicaid, or reduce the number of services that are covered by Medicaid. Like, those are the only
No
ways
one's
to
talking
balance
about
the
raising
budget.
taxes, so it's the other two.
Yeah, and I think even the proposals that I've seen at the State House to increase taxes that may or may not go anywhere, I don't think any of them would raise $500 million a year, right? Even
Like 113,
even the
something.
most, right? Even the most liberal ones. So
Right.
There would really be no getting around cuts to services, including at nursing homes.
And then to follow up, like you touched on this, but what would the average Rhode Islander do in this case? I mean, what would help?
Well, I mean, look, I think if Republicans in Congress go through with massive cuts to Medicaid or Medicare, we would be going back to the days when a large percentage of Rhode Islanders had no health insurance at all. And we would be in a situation where a lot of facilities would close down, not just nursing facilities, but also potentially community health centers, which are also under a very stressed financial situation to begin with. Community health centers like Thunder Mist and Wood River Health and CCAP and others, they would be facing real challenges as well. And we would be going back to the days where a lot of people would frankly have to use the emergency room as their primary source of health care, which leads to worse health outcomes, but also drives up costs for everybody else in their health insurance premiums for uncompensated care. So it would be bad news all around. Yeah.
Over the last decade or so, we've seen a spate of what I'll call either private equity-based or Wall Street-backed-based acquisitions of large medical facilities. Does the potential, if you will, cuts in these programs leave private independent nursing homes in states like Rhode Island at the mercy of those large organizations, many of which have led to bankruptcies?
I can't speak to that specifically, but I would imagine that the more that you squeeze the margins of an independent facility, the harder it is to operate as an independent facility, and the more likely you are to accept an offer from a large out-of-state owner. But I can't speak to any more.
I agree with that.
Yeah, you represent independent. What percentage, if you will, currently, of nursing homes and assisted living facilities in Rhode Island are still locally, air quotes, owned?
I want to say there's about 12 or 15 homes that are still owned by a family and they have one home. An individual owner like Cedar Crest in Cranston, it's owned by the Pizzelli family. They've owned it for many decades, but it's definitely a dying breed. People have gotten out, Medicaid doesn't cover the cost, and they get squeezed, and they don't have a lot of economies of scale. As a standalone facility, you don't get the same pricing that a large company gets on food and medical supplies and things like that. So they really get squeezed out of the business.